Welcome to the UC Davis PACES Just-in-Time videos. I'm Dr. Julia Magana, and I'm a part of PACES. Today I will share with you my discharge instructions for mild traumatic brain injury, also known as concussion. The CDC estimates that 837,000 emergency department visits each year are related to pediatric head trauma. So head trauma is a real issue for us. We have new data on pediatric concussion from Canada and great resources and a guideline from the CDC and the AAP. Check out the CDC's website, Heads Up. When I discharge a patient with concerns for concussion, I divide my instructions into a few buckets: somatic, school, sleep, and sports. But first off, families really want to know what a concussion is. Well, it's a type of traumatic brain injury that causes the brain to move within the skull and damages or stretches cells. This causes symptoms such as confusion, disorientation, loss of consciousness, or amnesia. Each child in concussion is unique, but 70 to 80% of children with concussion, or mild TBI, will demonstrate functional recovery by 1 to 3 months. That can feel like forever if the symptoms are debilitating. And we know that certain children are at higher risk, such as older children or adolescents, Latinos, children with more symptoms that are severe at presentation, children who report a higher level of acute post-concussion symptoms, children with a neurological or psychiatric disorder, children with learning difficulties, and children with family and social stressors, including lower socioeconomic status. First up are the somatic complaints. On the first visit, I recommend that the family take it easy, both physically and cognitively, for several days and watch for symptoms. Now, obviously, you can't staple a toddler to the bed. I just suggest not adding on things and focusing on relaxing activities at home. They should also avoid other activities that put them at risk for another head injury. My basic principle is, if it hurts, don't do it. For example, if running or doing drills causes a headache, dizziness, or other symptoms, don't do it. It requires the child really communicating with the family, and at times our athletes in particular won't share the symptoms that they feel because they want to keep doing that activity. So it's important to engage the child in this discussion so that they can really understand about concussion, symptoms, and management. The CDC recommends that we should use non-narcotic analgesia, that is acetaminophen and ibuprofen. But families should use this on an as-needed basis and be aware that using consistently for more than 15 days in the month can create a rebound headache. There are no other great supplements that we can recommend at this time, but the primary care doctor can explore other headache treatments if this is not sufficient. Families should keep a pain diary or a symptom diary to figure out what triggers the headache and try to avoid those triggers. So, for example, if lights make it worse, try sunglasses. Plan in breaks at school or with screens if school or screens are triggers. And that takes me to our next bucket, school. Concussions can impact our ability to concentrate even without a headache. But remember, not every concussion acts the same way, so some children may need more support at school than others. Parents and teachers should watch those kiddos those first few days closely to understand how much the concussion impacts that child at school. And the school can work with parents, but parents need a doctor's note to explain that there is a concussion and what to expect. The CDC's Heads Up website has a school note that you can print and use. Modifications will depend upon each child. If they have lack of energy or attention, try shortening the school day. Build in breaks or build in quiet places to work. The child may need to hear directions repeated or written down, and deadlines may need to be extended. That same CDC website has a great handout with tips for symptom-based recovery that I highly recommend. Okay, that was somatic and school. Now sleep. People with concussion sometimes are more sleepy and sometimes have trouble falling or staying asleep. The key here really is a routine. Allow for rest and break, but avoid a constant napping during the day if possible to help with night sleep. The most important question always seems to be, when can I get back to sports? Well, that's a hard one and not one that I'm going to answer on the initial visit. because we just don't know how this particular concussion is going to act. Personally, from the emergency department, I don't clear them to go back to sports. But I will let them know that they're not being put in concussion jail and there is hope. They should keep track of those symptoms and triggers, and then they will use a stepwise approach to go back to sports. Step 1 is back to regular activities such as school. If that went well, you can move on to next steps. Step 2, light aerobic activity. Step 3, moderate aerobic activity like running. Step 4, heavy non-contact activities like drills. 5, practice and full contact. And last, step 6, competition. But if at any of these steps symptoms return or worsen, you have to go back to the next step down. The key to successful concussion recovery is communication between the child, the parent, and the physician. We don't want to lock kids up in concussion jail, take them away from their support system, and decondition them by having them do nothing. We just need them to listen to their bodies, and if it hurts, don't do it. If the child has not had head imaging, then I have a lower threshold to have them see a doctor in the first few days. Without imaging, I want to see them with persistent vomiting, severe 8 to 10 out of 10 headaches, or altered mental status for sure. After the first few days, or if they've had negative imaging, I tell them to see a doctor sooner with uncontrolled headaches, vomiting, or balance problems. Everyone should plan to see their health care provider in about a week. And I am not clearing them to return to sports today. Well, that's it. Most concussions last a few weeks. Think about somatic symptoms, school, sleep, and of course, sports. Go to the CDC's website for more training and amazing patient discharge instructions. For more UC Davis specific resources on concussion, I recommend my own podcast, the EM Pulse podcast on pediatric concussions, with the author of some of the key research the CDC built their recommendations on, and the head team physician for UC Davis Intercollegiate Athletics. Also, for families, UC Davis has a podcast called Kids Considered that discusses concussions in a language families can understand. And for more PACES tips, follow us on the PACES YouTube channel.